this is your Houston chiropractor, Dr. Gregory Johnson, and today we have Charles with us, who is a missionary who's getting ready to go to Ethiopia for how many weeks?
3 months.
3 months. He's going down there on a mission trip and going to be helping out with the University Bible School, right?
Right.
And teaching, spreading the Word of God down in Africa. So God bless him and his trip. So we're going to take care of him before he leaves. Let's have you face the mirror here. I'm going to check your posture first. Let's have you flex your head forward and then backwards for me. Yep, and then all the way back. Yep. Does it still hurt right in here?
Yes.
Okay, same amount it did this morning?
Yes.
Okay. So he's had a upper thoracic problem right here in his right trap and levator scapula muscle. When he extends his cervical spine, it hurts there, pinches, and he's got some translation to the right of his cervical spine, plus some forward translation of his cervical spine. I have as well right now. I need an adjustment myself. Okay. I get this from working on you guys all day long and looking at you guys' posture and stuff. I had to bend my head forward all the time too.
Very influential.
Yes, it is. Gravity takes over from there too, and eventually gravity's gonna win that battle over everybody else.
And it's constant.
Yep. Okay, good. So let's go ahead and decompress you on this table next. We got some brand new medical pads made here with some. Go ahead and lay you in the back here for me, and pelvis right down below that bar. There you go. These pads are much softer with this new gel we had put on them, and we're actually having brand new decompression tables made, custom made for us right now, that we're going to be selling in the future and teaching this technique to other chiropractors throughout the world. The Johnson technique and the Johnson decompression BioPhysics table. This is adjusting the spine or decompressing the spine on the y-axis from the skull occiput all the way down to the sacrum, because we're pinning the iliac crest in down here. You feel like you're in there? Tight enough?
Yeah, it kind of hurts.
Okay, let me do this. Okay, so does that feel like it's right underneath of your, is this pin right on top of your pelvic bone? Feels like it to me.
Yeah.
Okay, so let me get this one in the same. Does that feel like it's on top of there better? Okay. There we go. Okay. Yeah, get this under his mandible in the front and then under his occiput back here. Take a deep breath in. Let it all the way out. Okay, good. Did you feel that all the way down? Not as like this morning? Yeah.
I felt it in the very bottom.
Okay, good.
I guess maybe the top already went.
Well, we got a lot of movement this morning. Okay, just relax your head. Hey, Renee, get in closer on this one. And do just a Palmer diversified cervical rotary break right there. Oh yeah, very nice. Okay. I close my eyes a lot of times when I do these adjustments because I can feel the joint range of motion better that way, and I won't go past the anatomical integrity of the ligament, which if you do causes a sprain. That's where a lot of people get hurt. Let's sit there sideways and come over here on your tummy. So skilled, artful chiropractors will know the full range of motion of a joint just by feeling it. You get into what's called the paraphysiological space, and that's where you hear the little cracking noise. That's the space that is beyond a patient's active range of motion and what we can do in passive range of motion to the anatomical integrity of the actual joint ligament itself. That's called the paraphysiological space. And that's where the carbon dioxide and nitrous gas explodes in there to create the cracking or popping noise that you all love to hear. I know you crack addicts out there love those noises. And by that I mean popping from adjustments. We are anti-drug in here, prescription and otherwise. Chiropractors, the only difference between chiropractors and MDs is we do not prescribe medication or perform surgery. Other than that, we can do anything and everything that a medical doctor can do, with the exception of those things. We do not prescribe medications or advise patients on medications, nor do we perform any surgeries where we pierce the skin with the needles or scalpels or anything for that matter, or do any internal exams. There we go. Put your head forward a little bit more here too, Charles, right there. And perfect. Now, we've had Charles in here twice a day for the last couple of days because he's leaving for his mission trip, so we wanted to get a lot done with him. Oh, boy, that moved great right there in that lower thoracic upper lumbar there today. Now, that should feel a lot easier coming up this time. Yep, good. Okay. Yeah, we're going to work on him with the Genie rub. I'm not using the turbinator on him because I don't want him getting too sore before he leaves town and not knowing what to do about it. So we're just going to make him feel really comfortable and get him healed up to his maximum potential at this point in time. This will be the 4th overall treatment. If you know anybody in what city is it you're going to again? Addis Ababa, Africa. That's the only chiropractors down there. Just email me at yourhoustonchiropractor@gmail.com and let me know, and I can email that information to Charles if they have internet access down there. I don't know. Or we can text it to you. I don't know if your phone will still be working down there or not. That sometimes kind of thing.
No, not my phone. The internet would work.
Okay. I didn't even realize they had internet and phone service in Ethiopia, but I guess they do. Renee and I are going on a mission trip in December to January, but ours is going to be down to St. Thomas, U.S. Virgin Islands. But people need to hear the word of God down there too. We're going to make a little vacation out of it at the same time. Plus it's Renee's birthday on January 1st, so we're going to take it down there for Christmas holiday. And January 1st, her birthday. And it's a great time to go scuba diving down there. We actually take some postgraduate education courses down there while we're there on scuba diving injuries, compression injuries, which are a lot different than these kind of compression injuries we treat in here. That's like the bends or compression, decompression sickness, which is known as the bends and lay circles. So see, we are doing a little transverse friction on his muscles in here. That's where before you noticed we were working more just longitudinally. Good. Okay, now his legs should be exactly even. And when we come up, his pelvis shouldn't raise way off the table and they should stay pretty even. Yep, pretty good right there. Maybe a little bit short on the right. That didn't hurt your low back, did it? Okay, good. Let's go ahead and turn you around on your back now. And I'm going to adjust his knees and his hip joints and back from this end, decompressing his knee, his hip joint, and his lumbosacral spine. Nope, that wasn't all of it. There we go, that was a little better. Feel that one up a little higher?
Yes.
Yeah. We get over here, check the stability of the knee always. He's got good, stable knees there. Nope, that wasn't all of it. There we go, good. Okay, good. Now let's have you sit up, face towards your knee. Okay. I'm just going to check his shoulder ranges of motion. Have you lift that chin straight up, look straight ahead. There you go. That's it. Right shoulder, glenohumeral joint moved really good there. Left one, good. Check both elbows, wrist, and fingers, the digits. Boy, that moved good too. There we go, good.
Hey, Dr. J.
Uh-huh. Okay. Okay, just to lay on your back for one more thing I forgot to do, and that's pull your hiatal hernia down. He's been having some problems with some acid reflux and pressure really under his sternum and in his rib cage there. And you can see that his, wow, that's a lot better than it was. It's almost even now. Look at that. Look at my thumbs compared to this morning.
Whoa.
That's a lot better. It was over an inch difference. Take a deep breath in now. Let it all the way out. Okay, I'm going to grab the top of his stomach, the fundus, and I'm going to pull that right straight down through the diaphragm so we can keep that down below the diaphragm in the lower compartment where it's supposed to be. And that's where it's supposed to secrete acid into the stomach, but that if it slips up through the diaphragm and through the hiatus, it'll secrete acid into the esophagus and create acid reflux, which is a sliding hiatal hernia. And one more time. All the way out there. Good. Excellent. Okay, there. Good job. Okay, now let's have you set up face towards your name one more time. And Charles, if you wouldn't mind sharing with our YouTube subscribers, how did you come to find us and come in here for treatment and choose us, and has that been worth it for you to do so?
Well, when I researched the internet of what my condition was, I felt like I had a hiatal hernia, and so I'm not a big believer in prescriptions or drugs or medical doctors, so I put chiropractor and hiatal hernia in the Google, and it brought up Dr. Johnson, and I studied it and read on it and looked on it, examined it, and I decided this is the person I want to go see. And so I called his lovely wife and made an appointment, several appointments at once, and it's been very well, very worth it, very worth it.
So you've been in here for now just for a couple of days, because this is right after Labor Day weekend, and this is your 4th treatment. And how would you say your hiatal hernia symptoms are now compared to when you first came in 2 days ago?
Oh, it's gone down 85, 90%.
Within 4 treatments. That's great. Well, thank you for sharing that with us, and we're going to be praying for you while you're down in Africa and wish you the very best, and we're going to see you when you get back.
All right.
This is your Houston Chiropractor. We'll see you next time.